Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Thank you for coming to my presentation. I'm here to present a research which entitled Factors Related to Perineal Wound Healing Among Postpartum Women at Cijantung Hospital, DKI Jakarta Province, Indonesia in 2021. My name is SHINTA Novelia and my team are Siti Samsyah and Indah Tanbasri. We come from Department of Midwifery, Faculty of Health Science, Universitas Nasional Jakarta. So here is my outline. I have introduction, objective, methodology, results, conclusion, and recommendation. First of all, I would like to start with introduction. So talk about perineal rupture. The main goals in postpartum care are to assist and support the woman's recovery and educate the mother about her own self-care. Most women have some degree of discomfort during the first few postpartum days, such as perineum rupture. As we know, perineum is a very sensitive area in which there are muscles involved in sitting, walking, bending down, squatting, urination, even defecation. So we need to pay attention on perineal wound healing, especially for postpartum women. And what are the complications of the perineal rupture? They are impaired mobility, which affected breastfeeding, delayed wound healing, infection, necrosis, dehiscence that require surgical interventions. And here we categorize the factors related to the wound healing of perineal in postpartum women into three categories. First, patient-related factors, which include knowledge, wound care practice, and nutritional status. The second one is nurse or midwife-related factor, which include knowledge and practice. And the third one is environmental factors. And actually, nursing intervention are intended to improve perineal wound healing. And we found the evidence that women who practice self-perineum care had better wound healing compared to those who did not. So we think that we need to identify the self-practice of the woman, including the knowledge. And here we catch the variable that knowledge, practice, and also we add one more variable, nutritional status, and we might want to know what factors related to the perineal wound healing exactly. So the objective is to analyze factors related to perineal wound healing among postpartum women. And the research questions are, what is the level of patient knowledge regarding perineal wound care? What is the level of patient practice regarding perineal wound care? What is the patient's nutritional status? How is the perineal wound healing of the patients? Is there a relationship between patient knowledge and perineal wound healing? Is there a relationship between patient practice and perineal wound healing? And is there a relationship between nutritional status and perineal wound healing? Let's see the methodology. Actually, this research was a cross-sectional study, and the data had been collected from January to April 2021 in postnatal ward of Cijantung Hospital, DKI Jakarta Province, Indonesia. The population was all postpartum women during the study period, which consisted of 130 people, and the sample was 98 people by purposive sampling. The inclusion criteria are postpartum women with grade 1 to 2 spontaneous perineal rupture and primiparals, while the exclusion criteria was women with pregnancy or childbirth complication. So the instrument that we used in this research were reader scale, questionnaire of the knowledge and wound care practice, and also medical record to assess the BMI of the patients as well. And the variables, including the IB and DV. The IB were knowledge, practice, and nutritional status, and the DV or dependent variable was the perineal wound healing. And the data had been analyzed by descriptive statistic and inferential statistic, which was chi-square test. So what are the results? Let's see. First, we found that majority of the respondents had high level of knowledge, which was 80.2%. And then majority of the respondents had a good wound care practice, which was 78.1%. And majority of the respondents had an ideal nutritional status, which was 66.7%. And majority of the respondents had a good perineal wound healing, which was 80.2%. And here are the results of the inferential statistic. We performed the chi-square test to see the relationship between two variables. And we found that there was a relationship between patient knowledge regarding perineal wound care and perineal wound healing. And then there was a relationship between patient practice of wound care and perineal wound healing. And the last one, there was a relationship between patient nutritional status and the perineal wound healing. So all the independent variables are associated with the perineal wound healing. So what we can conclude from this research, the factors associated with the perineal wound healing are knowledge, wound care practice, and nutritional status. And it is a kind of the patient-related factor. Nurses, midwives, and postpartum women should concern about factors related to perineal wound healing. And the perineal wound care need to be performed correctly by the nurses, midwife, and patients. We also recommend that the health education regarding perineal wound care need to be conducted to improve the knowledge of postpartum women regarding wound care practice, and also nutritional status must to be maintained during postpartum period. And last but not least, future research is needed to identify intervention to improve perineal wound healing among postpartum women. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.